If you really want to tackle the risk factors involved in developing heart disease, you really have to focus on other things. The obvious first thing would be lipidology, or cholesterol triglyceride management. So I have an interest in that and board certification in clinical lipidology. Also, if you don't sleep properly at night, it turns out that that has a huge effect on the cardiovascular system. We didn't really appreciate that maybe 10 or 15 years ago as much as we appreciate that now. So I have boards in sleep medicine, and now that I've done sleep medicine for quite a while, I realized I couldn't really take care of my cardiovascular patient without focusing on the sleep. Sleep is really as important as diet and exercise, healthy sleep. Patients, I think, want to understand and need to understand why they have found themselves with a heart problem. And to understand that, we need to understand that the lipids, the lipoproteins, the cholesterol, the triglyceride element is under control. Is the patient insulin resistant? Turns out that 2/3 of our patients with cardiovascular disease have a sugar problem. It isn't just a cholesterol problem. So we need to focus on triglycerides, insulin resistance, and glucose. We've always had this focus on cholesterol and heart disease. We need to think now not just about cholesterol, but about sugar and heart disease. No two patients are identical. No two hearts are identical. Even in identical twins, the hearts are actually quite different. So we have to individualize as much as possible each patient's issues. I'm a scientist. I'm drawn and attracted to science, and to see the changes in medicine and science is phenomenal. Almost every other day I read something that's come out on a genetic basis or investigational, a new therapy, a new approach. It's really fascinating to see the mushroom blow up of information in cardiovascular medicine.